everybody. Welcome to This Week in Pharmacy. I am the host of TWIRx, and if you're working out there in pharmacy land. It's 3:30 on the East Coast. It's 12:30 on the West Coast. We made an adjustment because we found out from our West Coast pharmacy people that you're busy when we normally did it at 9:30 in the morning. So we're going to make some shifts in changing our times of when we're going to be doing This Week in Pharmacy to be here for you as well, because I'd like to have more involvement throughout the nation on This Week in Pharmacy. And these ideas, the stories that we're coming up with are coming from our listeners. And I just want to give a shout out to our listeners. Thank you so much for all of the feedback that you're providing to the Pharmacy Podcast Network and to our 40 plus podcasters that are out there doing amazing work. I want to welcome a co-host today, which is Dr. Ryan Paul. You may have heard him and I and the rest of the crew talk about Symptomatic, which was a podcast from iHeartMedia. Ryan, it's good to have you here.
Hey, thanks for having me.
Absolutely. It's better and more fun to have someone else in the TWIRx studio other than just myself talking to the pharmacy people land out there. We had a lot going on this week, and you've had a lot going on this week, and I'm going to jump right out giving a shout out to the PBM reform. Breck Rice did an amazing episode that we're going to be promoting for the remainder of the week, and PBM reform is just heating up. We're going to actually be talking about this when the news comes up, but I do want to give a shout out to the listeners. PBM reform, a brand new episode out through Breck Rice. And then we're also going to be mentioning in the news something on pharmacogenomics, but there is an episode out in the Pediatric Pharmacist Review about pharmacy, specifically pharmacists dialed into pediatrics and pharmacogenomics. You know, in epidemiology, which Ryan, you have a very deep background in, pharmacogenomics takes a play in this, and it's something that I'm curious to just hear from you. What have you ever heard about the element and the evolution of how PGX is going to impact medication development, but more importantly, treatment customers where they are?
Yeah, I mean, I think that it's simply put is that pharmacogenomics is giving us the ability to be more precise in the way in which we're tackling population health. You know, epidemiology is looking at, you know, we always joke, and the idea is you can see me if you bring a group, but you can't see me if you're by yourself, right? So we're looking at large populations, and pharmacogenomics is giving us the data that we need to be able to be more precise in the development of medications. As a research scientist, it's really important for us to be able to have that information to be able to move forward. But then in the field, right, whether it's at the retail pharmacy level, in specialty pharmacy, in wholesale, whatever it might be, to be able to have the right data at the right time, at the right place, to be able to deliver to populations that are of need, that are, quite frankly, underserved, primarily those that are in vulnerable and marginalized communities.
You know, that's what we're going to be talking about on TWIRx News today. And it's interesting that you brought up specialty, because there's an article that just came out of Pharmacy Practice News just today, December 13th. And the title of this article is Specialty Pharmacy Set to Meet the Challenges of PGX Clinical Integration. And they're featuring Kristen Ashcroft, who is a rock star in the realm of pharmacogenomics. If you don't know Kristen Ashcroft, please look her up on LinkedIn. Yeah. But we're going to be talking about more of this at the NASP conference, as well as Assembia, because I really want to dial into how does a specialty disease state take advantage of the data that could be extracted from a PGX test ahead of time, especially if you're titrating from one med to the next. I can't say all the NABs that are in cancer care. In the transition, I've listened to pharmacists discuss that if that's going to help you dial in faster to get on the next treatment when you're undergoing therapy. Looking forward to it. I want to also give a shout out to our PGX for Pharmacists team, Dr. Becky Winslow and Dr. Benaz Sarami. They actually had an episode come out this week. Very interesting episode which was titled Pharmacists' Value in Clinical Pharmacogenomics. And they dial into a discussion with Dr. Jeremy Stewart, Chief Scientific Officer and Laboratory Director for Precision Genetics. And don't miss this episode if you're interested in PGX, because they really kind of dissect what's happening in clinical specific data and research, and how PGX is actually going to change a lot of research and moving forward. And I think that's going to come out into drug development too. More variants of a specific medication may be changed in order to dial into somebody's specific need.
Yeah, and we had that conversation when we were unsymptomatic as it relates to precision medication and the dilemma that we have in the development process, primarily when we talk about funding. Why? Because you're talking about developing drugs that are for very specific audiences, very specific patient populations, which means it's a smaller population, which means less money. And so there's a lot to be talked about as it relates to that. And, a shout out to Dr. Becky Winslow. If you want to know about pharmacogenomics, just simply go to her. She is an incredible resource for PGX.
Absolutely. All right. The bear in the room, or the cow in the room, or whatever that saying is it the bear in the room, or is it the elephant?
The elephant
in the room.
My favorite animal.
So let's talk about this headline from MediCity News, although it's on everywhere. It's on every publication out there following PBM reform. But Senator representatives introduce a bill that would ban joint ownership between an insurance company, aka the PBM, and a pharmacy. Now, this is a no-duh moment to me. I entered pharmacy in 2004, didn't understand PBMs, didn't even understand what that even was being, how it was being leveraged and talked about, and the changes it was, until about 2010. But the first thing that I recognized was, why are physician groups and why are grouping of pharmacies together constantly being smacked by a legal ease person talking about Stark Law, talking about things that are conflicts of interest? But why in the world would they allow these multi-billion-dollar organizations to own their own pharmacies and then be the one that's insuring them and giving the money to themselves? And then, of course, we know what happened. It's the disintegration of pharmacy throughout the nation. We're 8,000 pharmacies down from where we are 3 and 4 years ago. But what do you think of this? I mean, is this like is it as duh to you as it is to me that an insurance company shouldn't own pharmacies?
Yeah, I mean, an insurance company shouldn't own pharmacies. An insurance company shouldn't own a pharmacy benefit manager, and a pharmacy benefit manager shouldn't own a pharmacy. Just like a pharmacy should have a unique relationship with its wholesaler. The wholesaler should have a unique relationship with the direct, the manufacturers. There are, monopoly rules in place to be able to protect the consumer, and this happens to be one area of consumerism where the consumer is not protected. I actually think it's laughable, right? Because you're right. Number one, it is a duh moment, but this is something that, I've been having a conversation about since 2000, right? I grew up in a pharmacy family. I graduated high school in 2000. My grandfather owned a chain of pharmacies. He saw the writing on the wall that PBMs were coming in and reducing reimbursement to his independent retail chain. It wasn't sustainable. He actually sold his chain to Rite Aid, and we saw what happened with that, right? And we see what's happening with Walgreens, right? Walgreens is falling apart. It's looking for private equity money. And so, when you look at, CVS Health, you look at United Health Group, you look at Evernorth and Cigna, they are monstrosities. And they don't have a patient-centric motive in their body. Now, that doesn't mean that the people that work there don't. I know a lot of great people that work for those institutions. I do. But it is laughable that, CVS health spokesperson came out and what did they say? I was trying to pull it up in the Wall Street Journal because it was pretty funny. Essentially, what they came out and said was anything that got in the way of us being able to negotiate with pharma and with pharmacies was going to drive up the cost of medications to the consumer. So I have to call BS immediately because they are the ones driving up the cost to the consumer, right? The reality is that the consumer was buying directly from a markup on average manufacturer price, meaning we removed the wholesaler, we removed the PBM, and we removed everything but a dispensing fee at the pharmacy to take care of the clinical service that's being provided by the pharmacist, we would have a win, right? We would remove about 50% of the cost. Why? Because all of those drugs would have a very similar cost to a 340B pricing program, which is a totally other conversation, but it's a federally subsidized program. And so we are kind of at the crossroads again of my question not being, is this a good idea? But do you actually, does the legislature really understand what they're even talking about? Mm-hmm. And I don't think that they do, because I don't think that this bill is going to have enough teeth to do anything, right? Because you have to remove the actual practice, the way in which a pharmacy benefit manager is practicing. You basically have to tell them that they're just a claims adjudication company, and the only thing that they can charge for is a fee per employee per month, or per patient per month, or per member per month, or per adjudication transaction to process a claim on behalf of a health insurance company. They have to be completely removed from being able to control pricing in the game. And if they don't do that, then you've done nothing in that bill except for be performative and try to tell your constituents that you're doing something for them that, quite frankly, you're not doing. So I don't care if you're a Republican or a Democrat. I have yet to see somebody actually talk intelligently about how they're going to solve the problem.
Mm-hmm. If this is to take hold, if it is to come to pass, and it's a law that's put into place, it would mandate that the parent company, let's say United Health Group Corporation, has to get rid of, is it Optum or something? And then they have to do that within a 3-year period, get rid of all of their pharmacy ownerships at that point. And I'm sure things can be hidden in a bunch of other companies that they may or may not form, and it's understandable, but it's a starting point. My question is, from your viewpoint, if this is to be passed, does this now trickle to health systems that are insurance companies that also own pharmacies, who also employ physicians, that have way too much control over the ecosystem of health, in putting a firewall between insurance and provider?
Yeah, so I don't know if it trickles over. I think it maybe would set a precedent to maybe open up that door. I think that that's even a more difficult door than we think. Even though these players are not as big as the organizations that we're talking about today. But really, it's about behavior change, right? I mean, if we go back to just pharmacy benefit managers and reform, right? You've got the big three. The big three have 98% of the market. The other 2% is being vied for by about another 65 boutique PBMs. We first have to get those 65 boutique PBMs in a play where they understand that they're going to have to change their business model, and that it is to their benefit, because they are going to be able to pick up management lives as a result of legislation. So it's really about, it's not necessarily, so pharmacy benefit management in and of itself, formulary design and formulary management, being able to manage clinically aspects of the transaction, being able to provide customer service in a call center, all of those things are necessary to being able to service the patient. It's really about tackling what we are talking about, which is that elephant in the room, which is how pricing happens and how pricing is controlled by pharmacy benefit managers, and getting them to a place where, number one, there's no such thing as transparent. There's no such thing as pass-through. There's no such thing as a traditional PBM model where they're taking margin and spread and keeping rebates. None of that exists anymore. And all it is a transaction between what the price was sold for at the manufacturer and how the purchasing coalitions, GPOs, and wholesalers are working together to keep lowest net cost at a place where independent pharmacies can profit in a reasonable way, and patients can still afford their medications, and health plans are happy to continue to pay that premium.
Yep. A huge trend that's coming about, that's getting a huge amount of momentum. I've watched this grow since 2021, when I met Debbie Marcello out of the NCPA conference, and she jumped head into community pharmacy, where she would go to the community pharmacy and say, it's time to open a home care organization. And she was a trendsetter, because now the buzzword in community is home care. It's all about home care. It's long-term care at home. It's being able to be a long-term care like pharmacy, provide services, but then treat the home as a facility. And now instead of having 15 facilities, you have 225 facilities throughout your community where you're servicing people. And Debbie's team teaches these pharmacies, trains these pharmacies. You open up a franchise under Happier at Home. You're making cash business, but you're also understanding what is actually happening there. Why has my patient's adherence of medications become different than what it started out? What's happening in the home? Is there communication? Is there someone there? Are they bathing? Are they eating? Are they taking a walk? I think this touch, Ryan, is very important, and it does two things. Number one, provides more care. Number two, infuses this cash opportunity into our independent community pharmacies, who are no longer going to be 100% funded by the dispensing fee. I think we're going to see it go 50-50, where it's going to be 50% services and providing care and tracking care and doing everything. And of course, some things like this, where you could make money from home care. And then the other half, a dispensing fee. And I think that the new generation of pharmacy benefit managers need to pay attention to how and why they're reimbursing a pharmacy, a pharmacist, and then, of course, the clinical intelligence that they're bringing to the table to lower costs by possibly getting someone off a med. And I know that a pharma company doesn't necessarily want to hear that, but there are a majority of pharmacists out there who are dialing into the specific needs of their patients, and being able to see an environment of what your patient is living in, whether that be a great environment or not such a great environment. Is someone there to take care of you? Loneliness pops up, which is one of the worst things that can happen to somebody that lives on their own. But home care is a huge part of healthcare's future, and I'm excited to see that it's growing within community.
Yeah, I mean, I've had the conversation with independent pharmacists for many years about the necessity for diversification, and this is absolutely 100% an opportunity. Long-term care, hospice, just facility opportunities across the board in mental health, in addiction treatment, in oncology is a big one, infusion. The list is long, but it's really important for independent pharmacies to be diversified, to be working with facilities, to be able to have a specialty. Every pharmacy should be a specialty pharmacy, in my opinion.
Yeah. We'll have you back on when we talk more about specialty and mental health as well, because I want to dial into how pharmacists are going to have a huge opportunity in 2025 to become mental health experts in collaboration with other team members. But today's feature interview is with Brian Urban from Best Buy Health. I cannot wait for listeners to hear this interview in the future of the Geek Squad, entering in the home, setting it up for remote patient monitoring, getting involved with how technology is literally going to change the game for pharmacies, whether it's hospital system, long-term care, specialty, or community pharmacy. Technology is going to be a huge part of this. And we have to have implementation, have to have people to go into our patient's home who don't even know how to set up their Wi-Fi and be able to correctly dial into it. So we cannot wait for you to hear this interview. But before we do, we're going to just take a quick break to listen to our sponsor. Promise, Ryan, that you'll be back on TWIRx in an upcoming episode.
I'm with you.
All right. We'll be right back.
This is Debbie Marcello, host of the Happier at Home PRN podcast. Did you ever consider all of the potential cash revenue that you're giving away? What if you were to learn about services and products that you could keep in-house as opposed to referring your customers out? On my podcast, Happier at Home PRN, learn from the experts who have expanded their services to increase revenue, earn out-of-pocket payments, all while increasing the quality of care in their community. Listen to our past podcasts and join us for future episodes where we focus on growing your pharmacy into a thriving business. And we're not talking about keeping your head above water. We're talking about wealth and the survival of your pharmacy.
Hey, and on this week in pharmacy, this is a special episode. You know what? I love when we get to have people in the studio down here in Brownsville, Pennsylvania. If you are a Pittsburgh Steeler fan, hey, in the house, we got Steelers in the house. We got Steelers in the house. I got Brian Urban here with me from Best Buy Health, and he is sporting the Steeler Christmas hat, the Pittsburgh Steeler hat. If you're watching on YouTube, you're seeing this. If you're not, if you're just listening, just imagine a good-looking guy from Western Pennsylvania with his Steeler hat on. I love the Steeler hat. I love it. Look at you. Introduce yourself to the listeners, Brian.
Oh man, Todd, first of all, happy holidays.
Happy
Merry
holidays.
Christmas. This is a legit professional setup, and the growth you've had in your audience, viewership, content, it's hands down the best across the pharmacy space, let alone the rest of healthcare in the ecosystem. So happy to be here. I love this. So Brian Urban, head of population health commercial strategy at Best Buy Health. And if you've not heard of Best Buy Health, which many people have not, unless you're intimate to remote patient monitoring, coordination of chronic care management, transitional care, etc., it's new. It's a newer storyline. Even though we've been alive now for going on 9 years, our segments are expanding, our impact is deepening, and I'm really excited to kind of walk you through the history and a lot of what my work is a part of and a lot of what I think is on the horizon and kind of the outlook of the industry.
Yeah, I met you when we were at HLTH 2024.
Yeah.
Got an opportunity to understand what Best Buy was doing, was very surprised at the depth of what your organization has invested in. And then when you told me the story of the activation of the Geek Squad in the communities, it gave me chills because then I got it. All the dominoes for me at that point when you told me that story is, oh my gosh, I remember back in the like mid 90s, the early 2000s, the whole resurrection of like people not understanding they're going to throw their computers away because no one's helping them set them up.
Yeah.
Geek Squad comes in, starts saving people money because now it's like, hey, don't throw that thing away. Let us fix it. Let us do the firewalls. And all of a sudden now it's like you've entered health. So that is powerful.
It is. And I think just the name of Geek Squad, hands down, one of the most valuable looking long-term acquisitions that Best Buy could have made at that time. And man, it has paid tenfold in value to individuals and communities, now into health, let alone starting to enable what our technology can do beyond just entertainment and understanding your health at a surface level.
Yep. And I was thinking of the complexities of the age groups of adoption of technology, and there's a mixture in every group. You cannot swath a paintbrush on any demographic. Gen Xers, Gen Yers, the new people. Everybody has pockets of people who get it and pockets of people who just don't. Yeah. And for those that don't, that need to move ahead and need to have telehealth and need to have monitors and need enter in Best Buy Health, and that makes sense. And I'm like, wow, this is finally where I can see home-based connection back to technology, back to electronic health records, back to people monitoring, back to community pharmacy, which is my favorite topic to actually talk about. So talk to us about people that are listening are like, oh, Best Buy Health, wow, this gargantuan organization. But every time I talk to you, you personalize it. So kind of personalize it for our listeners and understanding how would a community pharmacy, for example, how would they leverage the Best Buy Health / Geek Squad fundamentals and mission?
Yeah. And I'll take one step back, give a little context into the history of, and then my perspective on what's transitioning from over-the-counter relationships that pharmacists hold and what that means in terms of value for improved health outcomes and going beyond the pill in a lot of sense. So Best Buy Health now turning about 9 years old. Corey Berry, our global CEO of Best Buy, tapped Deborah DeSanzo about 9 years ago, and she led IBM Watson Health for a good bit of time and leads a lot of other strategy across the ecosystem. And that investment then drew in some other great leaders, our chief medical officer, Ben Zaniello, chief commercial officer, Diana Gelston, Josh Will, chief revenue officer, just all these heavy hitters that have a legacy across the ecosystem. And they've built a really authentic culture and team wrapped around two key acquisitions. So what's now our lively business, which is personal emergency response devices. And that is for fall detection. And we're going into mitigation as well. And then our remote patient monitoring, which is cardiovascular, respiratory, and metabolic. And then there's a performance level as well, Oura Ring, Apple Watch, Fitbit, and then we have scales as well. And then we also have a lot of exercise equipment and entertainment too. So it's this whole wrap around how care is enabling, how technology is enabling care. And we're not delivering care. I think that's the thing that uniquely sets us apart of other retail stories that have transpired the last several years. Walmart, Walgreens, CVS. And I think that the challenge with delivering care as a retail, and this is kind of where I'm going to lead into what we're doing today, is you're dependent on that payment lever from Medicare. And it's the most complicated payment system, not only from accounts payable to actually get paid, but to navigate through as a reimbursement pathway in the entire globe. So our US infrastructure is the biggest competitor we probably have in delivering care. So our place is not to do that. It's to do our strength, which is enable care through tech. And the mission of it overall is to be able to enrich and save lives and meaningful connections through technology. And that, for me, makes so much sense, and what attracted me to come to Best Buy Health from a lot of my other initiatives and work career in the past. And now where we're going to personalize it, we have this technology. We have about 20,000 plus Geek Squad agents. 5,000 or so are dedicated to Best Buy Health, Geek Squad Health agents. We have this fulfillment logistics life device recycle center in Louisville, Kentucky, or Geek Squad City. We have a caring center, manages all of the responses from personal emergency response. We have a clinical command center who addresses and synthesizes all the data coming from these remote patient monitoring devices and helps coordinate care and accelerate, I think, chronic care management. So this is a crazy dream team. So when I looked at this, I said, wow, the application to population health is so significant, let alone shifting the economics and making care more effective and efficient. And when you think about pharmacy, the unique relationship that pharmacists have with a community and with patients is so deep that you can't even really compare it to primary care, where we have a huge gap in the country. Oncology, gerontology, where we're going to have over 90 million individuals aging well past Medicare eligibility, 65 and older, over the next 5+ years. Age tech is more prevalent now than ever, and a community pharmacist, and I was telling you before, is probably the most athletic healthcare worker in the country. They have more health touch points. They're more socially health aware in conversations. They're not scripted. They're not a part of the medical reimbursement infrastructure, which is very challenging and burnout ready for physicians now. So they're actually taking phone calls. They're doing digital health, drive-through, over the counter. And in my vision, when you start to couple that in a personal relationship of, hey, how else are you looking at your health, Todd? Well, it could be through some technology. How are you doing with your medication? Do you want to get off this medication at one point? How can you live in a healthier manner with your food choices, your exercise, your sleep? And it's just a more holistic way that I think where we're going, the pharmacy and our components of delivering technology and care separately is so unique. And I'm just really excited to explore that. We have a lot of new relationships that we're going into, and that's a little bit more of the story of it and kind of where we are today.
That's cool. That's cool. What I'm really excited about, and everybody listening knows me, the pharmacist being that hub of healthcare, the front line, the connection point that you have throughout the country. And now, of course, today where we see pharmacy deserts, unfortunately, popping up too quickly. And now people are out of care. They don't have anywhere to turn for the most simplest of care or the most complex of care. And when I think of Best Buy Health, I immediately thought of my friend over at IPC, which runs the division called iCare Plus. He's the president of that division. And Ashton Maaraba, he's with us here today. Ashton, it's so good to see you again and have you as part of this conversation.
Thanks, Todd. I appreciate it. Thanks for having me again. It's always a fun time being on the show. And, I echo Brian's sentiments. The evolution of the podcast network has literally taken off and become our premier industry podcast. So I always enjoy being back here. I think we've had a lot of fun in the past. I think we've had a lot of laughs, maybe those that haven't necessarily been showcased to the public, but and those that have been. But it's nice being back.
Well, what I'm excited about, Ashton, is everything that you've invested in over the last 4 years in building iCare Plus. When Brian was telling me about the implementation of the devices and how that's all this data is being fed somewhere. And then I thought, well, my goodness gracious, Ashton is part of a division concentrating on iCare Plus digital health monitoring. And what's going to end up happening is the IPC team is going to empower all these community pharmacies to not have to wait years to get this done on their own. They're going to now rely on this buying group that they're all part owners in. There's 4,000 plus 2,000 primary and another 2,000 that are out there. And then there's 50 of them actively using the iCare Plus system. Ashton and I met so many people like you, Brian, that were at Health, HLTH, that are doing some of the most dynamic things. And this today's conversation is just the beginning, because I'm thinking what Ashton's done, and now we put it in the hands of the Geek Squad to start implementation. I want you guys to just talk with each other about the capabilities of rolling out population health. And you and I talked about this before we started recording. Imagine someone in the emergency room, they're released home. Now what do? Well, guess what? 2 days later, Geek Squad shows up, wires the home up, everything that's needed for that disease state and disease state management. They're already part of an IPC pharmacy in the community that already knows their drug regimen, already knows what they're on, implements everything. Now, all of a sudden, there aren't any gaps in getting this stuff done. We talked about this digital health mystery word, AKA digital health, 5-10 years ago. Yeah. And it was still not like it was a great concept, and it was punchy and sometimes it working. Now it's like, it's ready to go. Like it's literally ready to implement. So I just want it from your perspective.
Yeah, I think it's incredible, actually, what you just mentioned, to make it real. So our Geek Squad Health agents are trained in a variety of ways. They're trained in social health. They're trained in paramedics. So they sit alongside paramedics in certain geographies, and they learn the process that a paramedic takes on an ambulatory visit, an ambulance call to a home. And in transitional care, think post-surgery or a organ replacement as well. When you think about lung, liver, kidney, and also terminal diseases relevant to those organs, you need to be able to monitor a patient ongoing. And there's an initial phase and then there's a long-term phase. We don't have capacity in our country to fill that right now. The PACE model of clinicians going in from elderly and frail in that population, that was a great model 50 years ago. Our economy has changed drastically. The sandwich generation is a real thing. And I'm one of them too. You have children, and then you have elderly, frail, aging parents that have a real cost figure to them, time-wise, monetary. And what do? Well, we have to balance the human side and then the tech side. And I think the Geek Squad for us does just that, because the Geek Squad will actually outfit someone's home and take care of a lot of technical issues and connectivity that they may not have the digital literacy to be able to do themselves. So we actually help educate and do it with them, set up their technologies, and then cover anything off from a surveillance perspective. If there's something dangerous in the home, and we won't survey in an invasive way, but if it's something that's of an urgent nature, we have the ability to have Geek Squad agents work with our clinical command center and then coordinate care or emergency services through care managers, or through close to kin, or through the individuals themselves too, to get some care they need. And closing gaps on that is critical. So it's the tech and connectivity and the literacy piece, but then it's also where I'd like to go now is deeper beyond into the food, hygiene, safety, transportation. And then also there's a companionship portion of that too that's really important. Geek Squad has a high level of trust, and trust is really a currency in our healthcare economy now. Patients own that ability to say, I trust healthcare. I'm going to go here as a preventative measure, or no, I don't trust them. I don't think I can afford it. And I think the reverse view of that from providers who are at risk for taking on bad debt, for people who either can't pay or won't go as a preventative measure. And then you see payers who have, in large part, lacked the ability to gain trust and engagement in a consistent manner throughout the history of really health insurance being a business in the United States, especially from the 80s on. And that currency is so important. So Geek Squad for us allows us not to go just to the front door, but then cross the threshold and go inside the house. And that's where care is now shifting. Care is going home. So you think about medication adherence as well. How is that being monitored relative to the drug efficacy or symptoms, and understanding what that is, and understanding a diet that's relative to taking certain medications. You think about blood thinners in particular. So there's so many components that I'm measuring that have significant value to the value of someone's health, let alone the economics of healthcare and payers and pharmaceutical manufacturers as well, and the research that's underneath that. So my view of this is Geek Squad is the secret sauce, and it's not delivering care, but it's being able to fill the gaps.
Yeah, and Brian said a key word, Ashton, and that's trust. The number one trusted healthcare provider in the nation through vote after vote after vote is that community pharmacist that knows their community, that knows what's going on with that patient, and being able to say to someone, hey, now it's time for you to use this system implemented by Geek Squad. Ashton, kind of give your imagination of how you see iCare Plus kind of fitting into this whole thing.
Yeah, just really quick, Brian, love your vision and where Best Buy Health is going with this, or where you're at presently. I think it's eye-opening for us as well. And I'm just going to take just a quick step back, just for our listeners and new listeners as well. Just to remind everybody who IPC is. Independent Pharmacy Cooperative is the largest independent pharmacy GPO in the country, group purchasing organization. We are a member-owned cooperative, which means that our independent pharmacy members own our organization. IPC Digital Health LLC is a wholly owned subsidiary to Independent Pharmacy Cooperative, and the iCare Plus brand is a brand under IPC Digital Health. So you're seeing a strong growth in the brand across our independent pharmacy members across the country. We're launching what we call a virtual healthcare ecosystem. We're launching digital healthcare clinics within the health deserts, within our distribution points. Each one of our member pharmacies that deploy iCare Plus is classified as that new digital healthcare distribution center. They launch a full array of iCare Plus digital health products, where we provide affordability and access to patients that are either uninsured or underinsured within those communities. Plus, as Brian mentioned, that triage when a patient is discharged from a hospital, we are a bridge and a conduit, a tool and a solution that we provide our pharmacies to help monitor those patients when they're discharged from a hospital, in order to make sure that their chronic condition is under clinical control, which is truly a huge issue in our country. Part of the rising costs in healthcare are those patients that are being discharged and readmitted because their conditions are not under control. We position our members, our community pharmacies, the independent pharmacies that that we care for and are part of our organization. And it is, as Todd mentioned, we have just north of about 2,000 members, but we also have another 5,000 warehouse customers that buy wholesale drugs directly from our wholesale drug distribution center, which is based out of Madison, Wisconsin, Sun Prairie, a suburb of Wisconsin. We've been able to tackle, we looked at the, what some of the problems are within the healthcare system and where patients are struggling to find affordability and access. That's how iCare Plus was born initially, and we continue to grow and collaborate with innovative healthcare partners. When I listen to what Brian is saying, I mean, he's right on the mark. One of the biggest and most important philosophies and strategies that we employ, that we execute at IPC Digital Health and under the iCare Plus brand, is making sure that we provide a hands-on solution to our member stores that deploy iCare Plus virtual healthcare centers. Number one, so they're prepared to execute within their community and to help optimize every part of our product and the service model. Second tier to that is that as we take care into the patient's home, there are a lot of benefits to remote patient monitoring and remote patient care, but we also find that patients also need that concierge service. So when you look at what Best Buy Health is delivering in terms of setting up components, setting up the tools, the interoperable medical devices, you look at what iCare Plus stands for in terms of a virtual healthcare clinic inside the pharmacy that complements the drug distribution side of the pharmacy. And then, let's say, for example, you have that acute care patient, that's suffering from an acute care issue, but actually may be suffering from a much more deeper issue that could be chronic disease. We put them into the remote patient monitoring category. We provide them a medical device that monitors their condition on a custom solution that iCare Plus manages and monitors, digital solution, very similar to electronic medical record or a remote patient monitoring platform, for a lack of better words. But those patients need education on an ongoing basis. So when we talk about costs of care, we also have to talk about subsidizing the caregiver. So, we believe that there's going to be a significant uptake in improved care with the triage of care that we provide at home with the strategy that, let's say, Geek Squad is providing. But we also know that if we put our pharmacists in position with tools to caretake for those patients when they're discharged from hospitals, tools that can help them with reimbursement, then that increases their velocity to maintain that care directly with that patient as the primary care provider when it comes to remote patient monitoring, and as that triage expert between the pharmacy, the physician, and obviously there's the specialists that are overseeing those patients at home. So I honestly believe that the Geek Squad strategy is extraordinary, and I think it complements our strategy, what we're doing at the pharmacy in order to prepare the pharmacies to take care of those patients, and then extend it to at home, which provides even more convenient care, leveraging our pharmacist under our telepharmacy light strategy, which requires that intervention on the iCare Plus platform on a regular basis in order to monitor the patient's real-time vitals and also to counsel them on drug interaction, the ability to escalate if they're running high. And obviously, I think just in other sessions that we've had, Todd, we've talked about some of our other partnerships that are fully interoperable and integrated into iCare Plus, like Uber Health. If that patient, let's say, for example, you have the Best Buy Geek Squad, Best Buy Health Geek Squad representative has set up the equipment. Our pharmacy is intervening as part of the triage of care. The patient's elevated. They don't have transportation to get to their primary caregiver that's part of, let's say, a remote patient monitoring case. Well, you can activate that directly through our platform. So we've really closed the circle of care, because you can't just have all these solutions without looking at every single little detail within the circle of care. You really have to look at it under a microscope and say, we've got a solution here, we've got a solution here, we've got a solution here. So today's future-ready modern tools are nothing like yesterday's tools.
Yeah,
I love it. I love it. And I love the fact that this is tailoring to the bleeding of the nation's pharmacy deserts issue by having someone like Best Buy, who has this international national strength reach of saying, hey, listen, we can come into the home and make sure that everything's set up for you to do a telehealth ongoing consult with your physician / pharmacist to do disease state management, to help you get better, to help you de-prescribe or help you take your supplement correct, or to help you get on this treadmill and stay on it. And all of these vitals, all of these data points coming back to a system like an iCare Plus is strengthening that community's health, because now you're making up for all those disappeared pharmacies over the last 4 years. 8,000 less pharmacies today than what we had four years ago. And now we're making up for it, as we always intended. When we used to talk about the science fiction 10 years ago, it's no longer science fiction. You guys are, the Geek Squads, walking into the home with a bag of goodies and setting up the Wi-Fi and getting it going.
Yeah.
It's true. It's amazing too that the change we've had in terms of rural access, like you're both mentioning here, is the closure of community pharmacies, and then also community hospitals as well. The medical care, aside from the therapeutic care too, is still a growing gap. If they're not acquired, they're usually closed. And there's only so much federal aid or state aid that hospitals can rely on. And their margins in terms of today's large health systems and operating margins is still 5% or lower. And you think about community hospitals where their population is very fixed. People aren't flying in to go get medicine in a community hospital or a federally qualified health center in another regard. And it's an access point for care, but it's also an access point for all of the other health needs underneath that too. And I think everything that Ashton was describing is so where we need to go, because it's making all this data more actionable and not just siloed in a bucket. And that we still have that across healthcare. That still exists. And I think it will always be an operating in a malfunctioning state for a while. But at least now we've progressively moved in the right direction to start to backfill some of the fiscal challenges a lot of these pharmacies and community hospitals have seen. Over 100 closures of community hospitals over the last several years is a really scary thing too. So rural healthcare is a huge play. So I think a lot of people are looking at Kaiser to see what they're doing with Risant now, and Geisinger's under there, and some more systems will be under there. And it's not just about it's about the human. It really is. It's finally, healthcare is finally being about the human, and a little bit less about the profit and the processes which people dictate. But it's finally becoming more human centered. And I think it's only because of the advancements in technologies, software, hardware, and now the people as the underwear, if you will, underneath that. So it's just about damn time. Just about time.
And you have to look at the underlying. Yeah, I mean, Brian again hits it on the nose. It's human impact. And when we look at the underlying factors that are impacting the human, I mean, you almost have to look at, people in general that are qualified candidates, whether those that are being discharged. I mean, Best Buy Health, their model makes sense. I mean, they're working with local hospitals. They're working with and triaging issues, monitoring problems with patients that are, let's say, in that highest category, the most troubled ones that are expensive to care for. And the hospitals are stepping up and saying, okay, so here's what we need to do. We need to get the equipment in this patient's house so we can get readings more readily to see what's really going on day to day or by the minute in real time on a regular basis. And that becomes really the standard when it comes to remote patient monitoring. You don't have enough readings today to really control a disease. If you're looking at, on the doctor side, unless you're, even when you diagnose, let's say, a hypertensive patient, the doctors, or even let's say if it's a borderline patient that hasn't been officially diagnosed, you don't have enough readings to effectively diagnose that patient historically if they're just visiting the doctor a few times a year.
Exactly.
You really need to maintain that constant monitoring, or the relapse. The drugs is an elevated reading on a consistent basis a result of, just a simple medication titration. You can't wait. You can't be passive. We have to always be ahead of the curve in healthcare. But the underlying elements, the underlying solutions, the outliers, that's where I think Best Buy Health comes in. That's where we come in as iCare Plus, and those that are within our world, so long as they're looking at the underlying issues, like, making sure that the equipment is set up, making sure that the equipment is agnostic. So it's not just encapsulated to one, let's say, healthcare tool. At iCare Plus, we were very conscious of that. We didn't want to encapsulate or enclose ourselves to this ecosystem that is closed to just a specific, tool. We made sure that we're agnostic to all medical devices, providing they meet a clinical standard. I know, Brian, you mentioned a few things when you started talking about, certain devices, but we made it clear that there's the recreational device and there's the clinical device. We'll look at data and we'll allow certain data on our system that's recreational data, like from the Fitbits and so forth. But if they don't meet the clinical standard, where a doctor can actually utilize the data to diagnose, then we'll have to we segregate that in its own filter. Whereas, let's say a device that's been peer reviewed, has published clinicals, meets the clinical standard, where a doctor can rely on the data to diagnose, then that makes your data that much more meaningful. So I think as you talked about population health and meaningful use data, we segregate meaningful use from recreational data. And that also gives a lot of significant meaning as we're working with payers and insurers that look at what we're doing, because we have to pay for this at the end of the day. I can't imagine Best Buy Health will continue to just kind of self-fund or, and we're in the same boat. We have to make sure that we can make sure that our independent pharmacies are being reimbursed through the adherence funnel. And that basically means if the patient's in a position at home and linked to your pharmacy where their condition will improve, and we can show that, and their improvement is improving our star rating, we're going to support it.
Yeah.
And we're going to reimburse you to mitigate those DIR fees that are impacting you, to mitigate all these other issues that you may be suffering from. So
it's a touchdown. It's a touchdown.
I just saw that. I'm like, did I just hit something on my screen?
No, over here. I like that.
No, I tell you what. No, it's football season. I'm a big Pittsburgh Steelers fan. So is Brian. Sitting with a Detroit Lions fan here with Maaraba.
There you go.
There.
Let's see if I can show this on the screen.
There it is.
There it is.
Let's go Lions. Yep.
Let's go Lions. Yeah, this is a big deal. So the reason why I played that Lions touchdown is because I love using the football analogy for healthcare and how our quarterbacks are our primary care, our running backs and our wide receivers are our pharmacists and our nurses. And the technology is that playmaking. It's that blueprint. It's like putting it together. And then you're releasing the geek squad out into the field to cover and mitigate the risks of things not working the way that it's correctly supposed to be put into place. And it's finally going to make healthcare work as we intended. Like I said, I've been a techie geek for 20 plus years now. And I remember talking about this stuff in the early 2000s. And I rolled my eyes after so many HIMSS conferences because I'm like, it's never going to happen. When's it going to happen? Yeah. It's finally here. It's really here.
Yeah, I mean, HIMSS is on its own right is very much a zoo that Hal has to year to year. But I think we're going to see a lot of different players coming into HIMSS the course of the next several years, because there's so many point solutions. And Ashton, you were talking about this before, is if we have these point solutions that maybe just hold this data captive, like that's their currency in a relationship between a payer or a provider, that just won't work. And we're device agnostic as well, just as what you were Ashton. And I think the bread and butter of where we've accelerated was the birth and the continuation of the acute hospital at home program. I see that from a policy perspective being a staple. I don't believe that's going to go anywhere. It's only created more access to care and shifted the economics into a healthier state than it was before, because care is going home. We have a gigantic aging population. We just talked about some numbers earlier. And I think the only way that we can do that is be device agnostic, be open to a lot of different strategic partnerships. There's a way to be competitive, but also co-opetition is more valuable toward the overall healing of our ecosystem in the US. and what that does at a societal level, community level, and an individual and family household level is almost immeasurable. If we can start to change the way people understand their health in relation to their day-to-day activities, whether it's through a therapeutic lens, whether it's through a device technology lens, or through a service lens as well, it's all health. Everything we're experiencing is health. So we can't hold our data captive. We can't be selective with device. We do follow device that goes through FDA clearance, because that's our purview. And I think it's touching all angles of health now. There was a sleep mat just about a month ago that got FDA approval, and we were talking about it, that it can sense heart rate movement when you're in deep sleep, and the measure of deep sleep to improving a chronic disease is huge. It's not just the drug, it's not just the food, the movement, it's the sleep component. It's so, what a complex human condition we have, that we have to keep coming up with different devices to be able to understand it more. But I think one day we'll come to more of a unified system of understanding human health at all levels in our society, such that we may not have the same type of innovation. We may exhaust our innovation in the space that becomes so coherent of how our health should be operating as a human. That's the crazy euphoric vision that I have, maybe hopefully less than a century out of reach, but we're an amazing time right now. And I think the medium of podcasting would not brought the worlds of Ashton and I together today. And I'm super thankful for that. We're past Thanksgiving, but that's an early Christmas gift.
No, I totally echo that. I think, the model of having an at-home care system hover around the setup and the implementation, and then the training, and then the platform, and then something that brings a tool with bridges that uniquely kind of brings in all the caregivers for that patient. I think that closes the circle of care. And I think that's what we're invested in on the Best Buy Health side. And then obviously the IPC Digital Health iCare Plus side. That's critical. That's the only way you're going to continue to get, again, the buy-in and then the elevation of the data. I think I said this before, the more readings you get, the more participation. I think the key is that you're almost developing a cult following from patient care standpoint, where patients will rely on what we're doing on a regular basis. They'll see it as this is a household. We talk about brand recognition, household names, consumer staples, but I think they'll look at this as a household essential if that type of care is required in the household, if certain monitoring is required. They can rely on our services. I think, Brian, to echo your sentiment, services is key, and it has to be consistent, at the same time. And I think that's a model that we must embrace, and that's where we win the trust of the community. And you're dealing with two organizations separately who built their whole, I would say, their individual ecosystems or their business models off of customer service. That's what we find. We're providing a healthcare service and customer service on the IPC side. I know on the Best Buy side, you're providing a customer service. On Best Buy Health, you're now providing a healthcare service with kind of that brand insignia as well. So it's great to meet you, Brian, to be honest. I think we're aligned, and I'm totally with you on the HIMSS piece, and not to call out people at HIMSS, but it can be a zoo. But I think what we found at Health, and we find at HIMSS, is that you're finding people that want to do business together there.
Yeah.
And we found some really key partners, and we've actually already taken off with a partnership in pilot. But we realized, look, this is a no nonsense deal. Let's get it done. And when two sides want to get together and engage in a business deal, it doesn't have to take a year or two to consummate it. It has to take a commitment, and we have a vision. Let's get it done. Let's start with a small sample size and forget about the bureaucracies and the red tape, and let's just get it done. Yeah. And that's what I liked about Health, because we came right out of it and we got it done.
I agree. I think everyone that was at Health, at least that I interacted with this year, sounds like you did as well, Ashton, was more or less everyone had like a VC mindset. They were like, let's find something, let's validate it quick. If it doesn't work, it's a good connection, and we can still love each other, and we can move on to the next potential partnership opportunity. But I think the venue has changed in conferences recently such that I think these conference centers realize, these organizations, industry groups realize, you need to have more of a interactive engagement, light and fun environment than such a didactic lecture. Maybe raise your panel or your hand at the end for a quick question from an executive you're trying to get in touch with. It's not like that. It's more heavy social engagement than I've ever experienced in my little career. And you know, I think HIMSS has an opportunity to reinvent itself. I hope they continue to make strides in doing that.
Changing. I see good changes happening.
Vive is cool. It's almost a little Dreamforce-y, you know, like Mark Benioff esque, which needs to happen. I mean, we need to make this fun. Tech should be fun. It doesn't need to be so technical and of a different language that not everyone can speak. It's becoming more universal because I think the environment and the mix these venues are starting to put together. So, I mean, Ashton, I look forward to seeing you in person. I know you're I think you're in East Coast time zone. No, you're just almost.
I'm actually in our headquarters. We, as you know, we visit our headquarters a lot in Wisconsin, but I'm based out of upstate New York.
Oh,
so I'll come and visit you guys anytime. You know, it's funny, Brian, you hit it on the nose in terms of, you know, when we were at HIMSS versus, let's say, health. I think if we talk about, when I talk about, like, you know, when I refer to getting that deal done quickly, and like you said, you know, like, you're goal oriented, you know, let's try a couple things, let's go. It's so funny, some of the conversations that I got into when I was at HIMSS versus when I was at health. And I think it just depends on who you talk to as well. But I remember talking to a payer, and I know this payer clearly understood that their star ratings have fallen to 3 and even borderline 2. And my suggestion is always do your homework before you come to these conferences if you don't know what your star ratings are. And number 2, if you think, and if you send people that represent your organization to the conference thinking that you guys have everything baked and you've got everything, you know, you're just not really kind of, you know, you're not fully understanding, or you don't think that you need any other opportunities to kind of come in and help you kind of shift the paradigm or think differently. Think again, because the reason why you'd have a 2 or a 3-star rating, which fell from a 4, is because you're missing the boat on patient outcomes. So just be ready to listen to those things. And I think at health, you found more that we're here to find a partner like you because here's where our issue is, or here's what we want to sustain. At HIMSS, we've got it under control. We're the best in the world. And I have no problem socializing that. And of course I won't name drop, but I think that those that are listening to this podcast, rethink who you're sending to the conference and prep them. Don't just wait for them to come back with a bag full of goodies saying, here's a quick summary. And then you jump right into your task management, forget about it. These are relationships that you can really foster and grow, you know, building a relationship with Best Buy Health, building a relationship with digital iCare Plus and digital health, and really kind of taking a deep dive. I think that would be rewarding to everybody. And Todd does a great job by presenting the podcast there and bringing the players to the podcast.
I tell you, my next podcast, I want a community pharmacy owner that had the partnership with the Geek Squad go into a home of a patient that he cared about or she cared about, and then the implementation of the iCare Plus system. And I want that whole thing to be spelled out as a story of success, because it's going to happen over and over and over again.
And I'll to that. So a large part of why I've been attracted to Best Buy Health, they didn't promote and I don't think we do that promotion well. We do a very strong attraction. And why I was attracted to come to Best Buy Health is because we examine in a thoughtful manner new strategic partnerships. We don't have a hard no. We have a let's find a way. And then if there's a beneficial end to it, whether it's together or if we refer you out to somebody else, that's the methodology that I'm taking into Best Buy Health, and that really authentically is already there. And a large part of my work is finding the right strategic partnerships across payer channel partnerships, across pharmacy and other retail organizations, and being able to have the ultimate economic shift from utilization management, right-sizing healthcare, access, and improving health through technology is my purview. And then what that might be on a partnership end is 100% my wheelhouse. And it's not just about developing new business. Like, yeah, we have to do that to exist, but it's developing the new unique models that can be replicated across a variety of populations in the US, from developed and to developing communities alike. And that's why I'm not a no guy. I'm not a crazy yes guy either, but I'm like, yes, let's find a way. Let's help each other. We all have value in this ecosystem to make it better than what it is today. So anyone out there listening, I mean, I'm an open door. You can easily find me on LinkedIn. I'm Brian Urban. I'm one of the less weird Brian Urbans out there on LinkedIn. There's a few weirdos out there, but you can find me there. And you know, it's an easy outreach, but partnerships is a big deal today. You have to be authentic and be willing to try. You can't be a guarded corporate monstrosity that just says no to everybody and has a power hold on the industry. That doesn't work. There's a next generation of leaders that are coming too, and I can tell you they don't work like that. And I'm really excited for that too.
I'm so with you, Brian. I mean, to the health systems that are out there, to the payers that are out there, cut the red tape, cut the bureaucracy. You're dealing with patients in your community, between Best Buy Health, iCare Plus, IPC, and IPC Digital Health. We really know how to make these things work. So and there are others out there, and I don't want to just talk just about us the whole time. You know, I think we have to be industry representative, but you just got to do your homework. Don't add so many layers of people coming into the room, and there's only so much analysis paralysis you can put into evaluating whether a project makes sense. I've been in this industry for 25 years, and myself, and I've had a lot of programs work, and I've had some that don't. But you don't know if you don't try.
Exactly. I think it's just continued learning too. If you're just stagnant in the traditional way of how our healthcare system is operated, wherever corner you're representing, that is such a short-term view. And if you're in the ecosystem, you're a decision maker, you're an influencer, you have a voice and a responsibility to be able to assess new partnerships and new opportunities. Otherwise, go somewhere else. Go into banking. I don't know. Go somewhere else.
Know, right?
You're in healthcare, man. It's about people. It's not about patients and members. It's about people, period. And if you get that stuff right, everyone will be fine. They'll make their money. You just have to have the right partnerships and be authentic and just knowing the people across the room and what they're trying to do as well. So I'm with you, man. I just and I can't wait to catch up. I didn't realize you're in upstate New York. We should meet in Ellicott. We should get some skis on our feet and meet in Ellicottville. I can't be too far from you.
We could meet halfway. There's what's that the ski resort, Peak and Peak? I think it's
outside Buffalo. Yeah.
That's actually
it's on
not
Todd's,
that far from
That's right off Erie, right? It's like halfway between here and Pittsburgh, right?
No, I'll go.
It's already
take me 3.5 hours to get up there.
Yeah.
Be ready. Unlock the power of technology and human condition. I want you to go to bestbuyhealth.com. Once again, that's bestbuyhealth.com. Brian, this has been a special episode. We threw this together quickly. Ashton, thank you so much for jumping on at the last minute. I always throw things at this guy. Ashton's always ready to go. I'm texting this guy within like 15 minutes of something happening. I'm like, can you please jump on here? And he did. So this team is real. They're in the trenches. This is why I like working with the community pharmacies through IPC. They're the salt of the earth. They're the ones that are literally like, every time a hurricane comes through, there's a disaster or something happening with the water systems. It's always that community pharmacies that's picking up the slack and getting involved because they understand. And if they had the power of an implementation team to put that tech in and be able to rely on something like Geek Squad, I think it's a match made in heaven.
And don't forget too, our government affairs team. We have a huge pharmacy advocacy group that we invest in every year on a day-to-day basis on Capitol Hill to advocate for industry issues like PBM reform. We also have an outstanding pharmacy services and clinical services programs. The other thing I wanted to mention too, so Brian, the biggest differentiating point. So I know you mentioned the chains earlier. There's the traditional independent, and then there's an independent that's still traditional but operates off of a healthcare network. That's what iCare Plus has become for our independent members. It's network. So that's what allows us to almost operate chain-like with certain programs, like when we work with payers and other opportunities. And that's something we've been able to launch under the iCare Plus strategy. So
wow,
that makes it a lot easier for our pharmacies to be part of one network, where we do start to really kind of look at, one big national clinic in a virtual healthcare ecosystem. So think of like a parent-child relationship. So that was our vision, in order to shift the paradigm with independent pharmacy and create this brand staple. So wherever you see the iCare Plus virtual healthcare center sticker, that's kind of like our Microsoft butterfly, our Best Buy health, our Best Buy kind of, logo. So.
Well, this has been a wonderful episode of This Week in Pharmacy. Pharmacists out there, technicians out there, you guys are the ones doing all the work. If there's anything that you have a question about, please reach out to IPC, reach out to the Pharmacy Podcast Network, reach out to Brian on LinkedIn even, and just connect with people. Ask questions. Yep. Let's get things together. Everybody's ready to go. It's just putting the puzzle together. If the puzzle piece is already baked, this thing's ready to go.
Yeah. Amen. I think the more collaboration we have, that's less conceptual and more real, and the quicker that can be, the quicker we can start to fix a lot of the stuff that needs fixed like yesterday.
Absolutely. Absolutely. Ashton, thank you so much. It's good to see you.
You got it.
All right.
Good luck this weekend, Pittsburgh Steelers.
Lions against Philly. Yeah, it's Friday the 13th. But it's
you have no idea how bad I want you guys to beat Philly. They're the only one standing in the way now between of Detroit winning that first place in the NFC, taking it all the way home to the championship game. So
I tell you what, I'll keep it civil, but I'm not a big fan of Philadelphia. I'll keep it civil.
We're not gonna say anything because we know we have a lot of customers in Philly, but
sport culture wise,
we love your teams. But let me tell you something.
Yeah, sport. I mean,
Detroit hasn't even been near. We've never touched a Super Bowl. We haven't even been inside a Super Bowl.
I think
give us one of yours in Pittsburgh.
I think it's really the win column for Super Bowls in Philadelphia is very cute. I mean, one's nice and simple. I wish we could lend some of our trophies over to them. Hopefully that'll give your audience a little start. But yeah, I just
stirring up some controversy, Brian.
It's a good place. I like the food. It's a good place to visit.
I'm too conservative, man. I should just open up like Brian right now. Let's go.
A day trip is nice to Philly, but I mean, a real culture. You know what I mean? Like a real blue collar, sometimes really no collar. That's Pittsburgh, man. Yeah, I mean, that's Pittsburgh. Steel, glass. It's the industry that's made the country. It's transitioned out of its dark days of coal and steel into breathable air now. But I think like that type of, that's a large part of honestly what I think about in my career moves too, is who is authentically willing to work hard and sweat and not sit back and hide or just sit back in a fluffy job. So a lot of the Pittsburgh mentality that I have that's just coded in me from being here, I try to take into my career in a loving, aggressive way. The only difference between us and Pittsburgh and Philly is off the rails aggressive, throwing batteries at Santa Claus and things like that years ago. We take more of a loving, thoughtful, aggressive approach into how can we get people better every day.
When you're on the bridge, we let you in.
Yes.
I'll just throw it in there.
Sorry, Philly.
I'm originally from Detroit, and I'm a Michigan State Spartan. And I'll tell you something. We just have one word that comes out of Detroit. And I think everybody knows what that is, and that's grit. So, Dan Campbell set the precedent for Detroit sports, and I would say the business community. I think my son said it most. A football team is the soul of a community, and then when you kind of look at it too, those of you that are not football fans, I echo exactly what Brian is saying when it comes to healthcare in a community, because I know we're just trying to circle it back to make sure we stay on that healthcare topic. Grit and commitment all the way around. So
Well,
I
hey,
love you, Philly
thanks.
folks. Though I was just messing with you. That's
we love
the natural way
I want
of
an
expressing
all
love.
I want an all Pennsylvania Super Bowl someday.
Oh, I would love that.
And that'd be crazy.
I would have.
that's not going to happen this year because
Listen,
the Lions are going all the way.
I'm so happy
guys.
you found your place against the Packers. Like that's
right.
I don't think the Packers are going to be coming back to where they once were.
Yeah. Well, I can't say anything about that. Todd will tell you why, because I would say maybe like 80%, maybe 100% of our team in Sun Prairie, they're all Packers fans. In fact, a couple of them lost a bet a few years ago. So if you're listening, you're going to wear that Lion sticker on your face.
Because we have a lot of Vikings fans in Minneapolis, Minnesota, where our global headquarters are at, and then our tech headquarters are in Boston too. Which I can't say anything about the Patriots because I feel bad.
We'll put your hat back on one more time before we're out.
By the way, Philadelphia folks, have a happy holiday. I'll enjoy the victory. At least Saquon is on a.
This hat is
there
awesome.
It is. Is that beautiful?
It is.
It's got natural ketchup, Heinz ketchup stains in here, and sauerkraut.
Is it really? I don't think I can see that all the way from here.
It's falling on any restaurant and bar floors. And
in
it's
Permanis,
survived. A couple Permanis.
That's right.
Floors. Yeah.
All right. Well, we have to get out of here. It's wrapping up to our hour. We want to say thank you to the listeners. Please go subscribe on all platforms, Apple, Spotify, anywhere that you're listening to podcasts. Thank you so much to Brian for being our special guest today. Ashton, thank you for your support. We couldn't do this without you guys. And we'll talk to you next time on This Week in Pharmacy.
This episode is sponsored by Independent Pharmacy Cooperative, widely known as IPC. Established in 1983, IPC is the nation's largest group purchasing organization owned by independent pharmacy. With a mission of maximizing the success of community pharmacists, IPC works to provide members with access to effective programs and services designed to enhance profitability for independent pharmacy. Read more about our mission by checking out our website at ipcrx.com. That's ipcrx.com.